Sponsored by RxCardClub.com. Get a free prescription drug card and save up to 85% on prescription drugs. RxCardClub.com. How do Celebrex and Ibuprofen compare? Celebrex, celecoxib, and ibuprofen are both nonsteroidal anti-inflammatory drugs, NSAIDs, used to treat pain and inflammation. However, they differ in their strength and how they work in the body. Ibuprofen, commonly sold under brand names like Advil and Motrin, ibuprofen is typically taken in dosages of 200 to 800 mg per dose, 2 to 4 times daily. Celebrex, typically prescribed in doses of 100 mg or 200 mg per dose, 1 or 2 times per day. How many ibuprofen equal 1 Celebrex? There is no direct one-to-one equivalence between ibuprofen and Celebrex due to their different potencies and mechanisms of action. It is also important to consider the overall effectiveness and side effects. Based on typical dosing, 100 mg Celebrex is considered equivalent to about 200 to 300 mg of ibuprofen. 200 mg Celebrex is considered equivalent to about 400 to 600 mg of ibuprofen. This comparison can vary based on individual responses to the medication, so it's important to follow a doctor's advice. Celebrex versus ibuprofen, mechanism of action. Both Celebrex and ibuprofen work on COX, cyclooxygenase, enzymes, which are involved in inflammation, blood clotting, and normal protein functioning. There are two types of COX enzymes, COX-1 and COX-2. COX-1 helps maintain the normal lining of the stomach and intestines, controls important blood clotting pathways found in platelets and blood vessels, and is involved in kidney function. COX-2, mainly found at sites of inflammation. Celebrex is a selective COX-2 inhibitor, meaning it specifically targets COX-2, while not targeting COX-1. Ibuprofen is a non-selective COX inhibitor, meaning it works by inhibiting both COX-1 and COX-2 enzymes. Related questions: can you take ibuprofen if you have COVID-19, coronavirus? Naproxen versus ibuprofen, what's the difference? Meloxicam versus ibuprofen, what's the difference? Celebrex versus ibuprofen, side effects. Celebrex is associated with fewer gastrointestinal side effects than non-selective NSAIDs, but there is a theoretical risk of cardiovascular events, although this has not been conclusively proven. Celebrex is associated with a lower risk of gastrointestinal bleeding compared to non-selective NSAIDs, making it a preferable option for long-term use in some patients. Because ibuprofen inhibits both COX-1 and COX-2, it can cause gastrointestinal side effects, such as stomach ulcers and gastric bleeding, but may reduce the risk of blood clots and cardiovascular events. Celebrex versus ibuprofen, duration of action. Celebrex has a longer half-life than ibuprofen, allowing for less frequent dosing. Celebrex is often taken once or twice a day, while ibuprofen may need to be taken every 4 to 6 hours. RxCardClub.com. Get a free prescription drug card and save up to 80% on prescription drugs.